Moving on from the election now and turning to the COVID-19 situation in South Korea, the country is set for yet another record number of daily infections when the official numbers come out in just over an hour from now, with cases way over 320,000 even as of late last night.
In a move to better manage the surging number of patients, authorities have decided to allow more medical facilities to prescribe oral treatments. For more on this, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
So like always, let's start with the local infections.
Well, Mok-yeon, we're forecast to see yet another record-breaking figure of COVID-19 cases today, as figures from midnight to 9 p.m. Tuesday have already surpassed 300,000. Over that period, South Korea saw over 326,000 cases, a huge jump of almost 130,000 cases from the day before. So we're expecting today's tally to potentially reach a whopping 350,000. Including the latest figures, the country's total caseload has surpassed 5.1 million, meaning 1 in 10 people in South Korea has had COVID-19. The country passed the 4 million mark just last weekend, and it only took 4 days for the 5 million mark to be hit.
Yeah, I remember when Omicron first arrived in South Korea, it didn't seem like we had many cases at all at the outset, but how quickly that changed to the situation we're in now. In a bid to handle this spike, we hear that the antiviral drug developed by Pfizer is going to be made available at more areas of distribution.
That's right, Mark. Starting today, general hospitals, psychiatric hospitals, and rehabilitation medical centers can prescribe Pfizer's Paxlovid to COVID-19 patients as well. Up until now, oral pills could only be prescribed by medical institutions, local clinics, and hospitals that were designated to treat COVID-19 patients recovering from home. And also today, another 45,000 courses of Paxlovid will arrive in the country, which means the country has so far received 163,000 courses. The treatment was first introduced in mid-January and has been administered to more than 25,000 people as of last Friday, mostly to people recovering at home.
But Min-jung, we hear that PCR testing requirements for inbound travelers will also change beginning Thursday.
Right, Mok-yeon, authorities have decided to reduce the number of mandatory PCR tests as demand for tests soared due to the rapid spread of the virus. To increase efficiency, inbound travelers will no longer have to get 2 PCR tests on the day of arrival and the 7th day after arriving. And from tomorrow, PCR tests will only be required in the first day of arrival, and on the 7th day, people will be asked to take the rapid antigen test instead. Measures have also been eased for people working at nursing facilities. Those who have gotten their fourth shots will no longer have to take regular PCR tests twice a week.
Well, that's going to make it more convenient for them. Well, thank you, Min-jung, as always, for your report.
Thank you.